1. What is the primary cause of amyotrophic lateral sclerosis, ALS? A. Genetic mutations. B. Viral infections. C. Environmental toxins. D. Autoimmune diseases. Answer: A. Genetic mutations. Rationale: ALS is primarily caused by genetic mutations, with approximately 5 to 10% of cases being familial. Although environmental factors may contribute, the main driver is the mutation in certain genes, such as C9orf72. Viral infections, autoimmune diseases, and toxins are not primary causes of ALS. 2. Which of the following is the most common symptom in the early stages of ALS? A. Muscle weakness. B. Difficulty swallowing. C. Seizures. D. Blurred vision. Answer: A. Muscle weakness. Rationale: muscle weakness, especially in the arms or legs, is the most common early symptom of ALS. Difficulty swallowing, dysphagia, may occur later, and seizures or visual disturbances are not typical early symptoms of ALS. 3. Which diagnostic test is primarily used to confirm the diagnosis of ALS? A. MRI of the brain. B. Electromyography, EMG. C. Serum creatine kinase, CK, levels. D. Urine analysis. Answer: B. Electromyography, EMG. Rationale: electromyography, EMG, is the primary diagnostic tool used to confirm ALS. It detects abnormal electrical activity in the muscles, which is a hallmark of ALS. While MRI and CK levels may be used to rule out other conditions, they are not diagnostic for ALS. 4. Which of the following is a common complication associated with ALS? A. Respiratory failure. B. Hypertension. C. Hyperglycemia. D. Hyperthyroidism. Answer: A. Respiratory failure. Rationale: respiratory failure is a common and severe complication of ALS due to the weakening of respiratory muscles. Hypertension, hyperglycemia, and hyperthyroidism are not common complications of ALS. 5. What is the primary treatment for ALS to slow progression of the disease? A. Riluzole. B. Prednisone. C. Methotrexate. D. Interferon. Answer: A. Riluzole. Rationale: Riluzole is the only FDA-approved medication that has been shown to slow the progression of ALS. Prednisone, methotrexate, and interferon are not used in ALS management. 6. Which of the following symptoms is often seen in later stages of ALS? A. Cognitive decline. B. Weight loss. C. Insomnia. D. Fever. Answer: B. Weight loss. Rationale: weight loss is a common symptom in the later stages of ALS due to muscle wasting and difficulty swallowing. While cognitive decline may occur in some patients, it is not seen in all cases. Insomnia and fever are not specific to ALS. 7. Which of the following is a common risk factor for developing ALS? A. Age over 50 years. B. History of frequent viral infections. C. High blood pressure. D. Family history of ALS. Answer: D. Family history of ALS. Rationale: a family history of ALS is a known risk factor, particularly for familial ALS. Age over 50 years is also a risk factor, but viral infections and high blood pressure are not direct risk factors for ALS. 8. Which part of the nervous system is primarily affected in ALS? A. Peripheral nervous system. B. Autonomic nervous system. C. Central nervous system. D. Enteric nervous system. Answer: A. Peripheral nervous system. Rationale: ALS primarily affects the motor neurons in the peripheral nervous system, leading to muscle weakness and paralysis. The central nervous system and autonomic nervous system are less directly involved, and the enteric system is unrelated to ALS. 9. Which symptom is most commonly associated with ALS in the final stages of the disease? A. Difficulty speaking. B. Nausea. C. Skin rashes. D. Uncontrolled movements. Answer: A. Difficulty speaking. Rationale: in the final stages of ALS, patients often experience difficulty speaking, dysarthria, due to weakening of the muscles responsible for speech. Nausea, skin rashes, and uncontrolled movements are not hallmark final stage symptoms. 10. Which of the following physical therapies is most commonly used in ALS to maintain function? A. Strength training. B. Aerobic exercise. C. Range of motion exercises. D. High-intensity interval training, HIIT. Answer: C. Range of motion exercises. Rationale: range of motion exercises are typically used to maintain joint flexibility and prevent contractures in ALS patients. Strength training and aerobic exercises may not be feasible as the disease progresses. HIIT is not a recommended exercise regimen for ALS patients. 11. Which of the following is a hallmark clinical feature of ALS? A. Sensory loss. B. Spasticity. C. Cognitive impairment. D. Seizures. Answer: B. Spasticity. Rationale: spasticity, muscle stiffness, and spasms is a hallmark clinical feature of ALS due to upper motor neuron involvement. Sensory loss, cognitive impairment, and seizures are not primary features of ALS. 12. What is the primary goal of nursing care for a patient with ALS? A. Cure the disease. B. Provide pain relief. C. Maintain respiratory function. D. Treat infections. Answer: C. Maintain respiratory function. Rationale: maintaining respiratory function is a key goal in ALS care, as respiratory failure is the most common cause of death. Pain relief and infection management are important but secondary goals. ALS is not curable. 13. Which type of ALS is most likely to be inherited? A. Sporadic ALS. B. Familial ALS. C. Progressive bulbar palsy. D. Primary lateral sclerosis. Answer: B. Familial ALS. Rationale: familial ALS is inherited in an autosomal dominant pattern and accounts for about 5 to 10% of ALS cases. Sporadic ALS, which has no known family history, is more common. Progressive bulbar palsy and primary lateral sclerosis are types of ALS, but not specifically inherited. 14. Which of the following is commonly seen in ALS patients? A. Hyperreflexia. B. Hyperkalemia. C. Hypotension. D. Hypothermia. Answer: A. Hyperreflexia. Rationale: hyperreflexia, overactive reflexes, is common in ALS due to upper motor neuron damage. Hyperkalemia, hypotension, and hypothermia are not characteristic features of ALS. 15. What is the expected lifespan for a patient diagnosed with ALS after onset of symptoms? A. Less than 1 year. B. 2 to 5 years. C. 5 to 10 years. D. More than 10 years. Answer: B. 2 to 5 years. Rationale: the median lifespan after the onset of symptoms is typically 2 to 5 years, although this can vary. Some patients may live longer, especially with early diagnosis and supportive care, but ALS is ultimately a fatal disease. 16. What is a key feature of ALS that differentiates it from multiple sclerosis? A. Sensory deficits. B. Muscle weakness and atrophy. C. Visual disturbances. D. Cognitive decline. Answer: B. Muscle weakness and atrophy. Rationale: ALS is characterized by muscle weakness and atrophy due to the degeneration of motor neurons. Multiple sclerosis, in contrast, often causes sensory deficits and visual disturbances. Cognitive decline can occur in ALS, but is not as common as in other conditions like Alzheimer's. 17. Which medication is commonly prescribed to help manage spasticity in ALS patients? A. Baclofen. B. Diazepam. C. Furosemide. D. Lisinopril. Answer: A. Baclofen. Rationale: baclofen is commonly prescribed to manage spasticity in ALS patients. Diazepam may also be used for muscle relaxation, but baclofen is preferred. Furosemide and lisinopril are used for other conditions and are not relevant to ALS spasticity. 18. Which of the following should a nurse assess frequently in a patient with ALS to prevent complications? A. Blood pressure. B. Oxygen saturation levels. C. Skin integrity. D. Urine output. Answer: B. Oxygen saturation levels. Rationale: ALS patients are at high risk for respiratory failure, so oxygen saturation levels should be closely monitored. Blood pressure, skin integrity, and urine output are important, but less critical for this specific condition. 19. Which of the following is a potential complication of ALS that can lead to life-threatening issues? A. Respiratory muscle weakness. B. Low blood sugar. C. Hypertension. D. Renal failure. Answer: A. Respiratory muscle weakness. Rationale: respiratory muscle weakness is a serious complication of ALS that can lead to respiratory failure and death. ALS does not typically cause low blood sugar, hypertension, or renal failure. 20. Which of the following therapies may be used to improve quality of life for ALS patients? A. Bone marrow transplant. B. Physical therapy. C. Chemotherapy. D. Immunosuppressants. Answer: B. Physical therapy. Rationale: physical therapy is essential to maintain mobility and manage pain and spasticity in ALS patients. Bone marrow transplant, chemotherapy, and immunosuppressants are not effective for ALS treatment. 21. Which of the following is most commonly affected by ALS in terms of motor function? A. Legs. B. Hands. C. Tongue and throat muscles. D. Face muscles. Answer: C. Tongue and throat muscles. Rationale: the tongue and throat muscles are commonly affected as ALS progresses, leading to difficulty with swallowing and speaking, bulbar symptoms. The disease also affects the legs and hands, but bulbar symptoms tend to cause more significant problems later in the disease. 22. Which part of the nervous system is primarily affected in ALS? A. Peripheral nervous system. B. Autonomic nervous system. C. Central nervous system. D. Somatic nervous system. Answer: C. Central nervous system. Rationale: ALS affects both the upper and lower motor neurons, which are part of the central nervous system. The peripheral nervous system and autonomic nervous system are less directly involved. 23. What is the main genetic mutation associated with familial ALS? A. C9orf72. B. AP gene. C. BRCA1 gene. D. P53 gene. Answer: A. C9orf72. Rationale: the C9orf72 gene mutation is most commonly associated with familial ALS. The AP gene is related to Alzheimer's disease, and BRCA1 and P53 genes are involved in breast cancer and tumor suppression, respectively. 24. Which of the following is an important consideration when developing a care plan for a patient with ALS? A. Ensuring regular exercise. B. Protecting the patient from infection. C. Promoting a high-protein diet. D. Teaching the patient to improve memory. Answer: B. Protecting the patient from infection. Rationale: ALS patients are at risk of infections due to respiratory muscle weakness and impaired swallowing. Regular exercise may be helpful, but it must be done cautiously. A high-protein diet may help with muscle wasting, but infection prevention is the most critical consideration. 25. What symptom is commonly observed in the later stages of ALS? A. Memory loss. B. Seizures. C. Difficulty breathing. D. Vomiting. Answer: C. Difficulty breathing. Rationale: as ALS progresses, difficulty breathing becomes more prominent due to respiratory muscle weakness. Memory loss and seizures are not typically seen in ALS, and vomiting is not a major concern in the later stages of ALS. 26. What is the role of speech therapy in ALS care? A. To improve respiratory function. B. To help with communication. C. To prevent muscle spasms. D. To correct swallowing difficulties. Answer: B. To help with communication. Rationale: speech therapy is essential for ALS patients to maintain communication skills, especially as bulbar symptoms affect the ability to speak. Respiratory function, muscle spasms, and swallowing difficulties are addressed through other therapies. 27. Which of the following is a characteristic of the late stage of ALS? A. decreased appetite. B. Increased muscle strength. C. Impaired cognition. D. Inability to move voluntarily. Answer: D. Inability to move voluntarily. Rationale: in the late stages of ALS, patients often lose the ability to move voluntarily due to extensive motor neuron loss. Decreased appetite and impaired cognition can occur, but muscle strength will not increase, and cognitive decline is not always seen in ALS. 28. What is one of the first signs of ALS? A. Loss of coordination. B. Difficulty swallowing. C. Muscle weakness. D. Numbness in extremities. Answer: C. Muscle weakness. Rationale: muscle weakness, especially in the limbs, is often one of the first signs of ALS. Loss of coordination, difficulty swallowing, and numbness in extremities are not typically early signs of ALS. 29. Which of the following ALS treatments is aimed at slowing disease progression? A. Gabapentin. B. Riluzole. C. Opioids. D. Steroids. Answer: B. Riluzole. Rationale: riluzole is the only drug that has been shown to slow the progression of ALS. Gabapentin is used for nerve pain, opioids for pain management, and steroids for inflammation but are not effective for slowing ALS progression. 30. Which of the following would a nurse include in the teaching plan for a patient with ALS regarding swallowing difficulties? A. Encourage a high-calorie, low-protein diet. B. Recommend soft, thickened foods. C. Advise against using a feeding tube. D. Suggest swallowing exercises. Answer: B. Recommend soft, thickened foods. Rationale: for ALS patients with swallowing difficulties, soft, thickened foods are recommended to prevent aspiration. A high-calorie, low-protein diet is not appropriate, and feeding tubes may be needed as the disease progresses. Swallowing exercises may not be effective in advanced stages of ALS. 31. Which of the following is the most common initial symptom of ALS? A. Muscle cramps. B. Muscle atrophy. C. Difficulty swallowing. D. Muscle weakness. Answer: D. Muscle weakness. Rationale: the most common initial symptom of ALS is muscle weakness, typically affecting the hands or feet. Muscle cramps, atrophy, and swallowing difficulties may develop later, but are not usually the first signs. 32. Which of the following laboratory findings is typical for ALS? A. Elevated liver enzymes. B. Increased serum creatinine. C. Normal electromyography, EMG. D. Increased creatine kinase levels. Answer: D. Increased creatine kinase levels. Rationale: increased creatine kinase levels may be observed in ALS due to muscle damage. Elevated liver enzymes and creatinine are not characteristic of ALS, and an EMG typically shows evidence of denervation and fasciculations. 33. What is the role of occupational therapy in ALS management? A. To improve cognitive function. B. To assist with feeding. C. To help maintain independence with daily activities. D. To address speech and language difficulties. Answer: C. To help maintain independence with daily activities. Rationale: occupational therapy is focused on helping ALS patients maintain independence in daily activities for as long as possible. It does not focus on cognitive function, feeding assistance, or speech difficulties, which would be addressed by other therapies. 34. Which of the following is a potential complication of ALS that affects the respiratory system? A. Pleural effusion. B. Aspiration pneumonia. C. Pulmonary embolism. D. Asthma exacerbation. Answer: B. Aspiration pneumonia. Rationale: aspiration pneumonia is a common complication of ALS due to dysphagia, difficulty swallowing, and impaired airway protection. Pleural effusion, pulmonary embolism, and asthma exacerbation are not direct complications of ALS. 35. Which statement regarding ALS and respiratory function is true? A. Respiratory failure is rare in ALS. B. Mechanical ventilation is not helpful in ALS. C. Respiratory muscle weakness contributes to difficulty breathing. D. Respiratory function typically improves with treatment. Answer: C. Respiratory muscle weakness contributes to difficulty breathing. Rationale: respiratory muscle weakness is a key factor in ALS-related respiratory difficulties. This leads to progressive breathing problems and eventual respiratory failure. Mechanical ventilation may be used to manage respiratory failure, but does not improve the underlying ALS. 36. Which of the following is a sign that ALS is progressing in a patient? A. Increased reflexes in the arms. B. Improved hand strength. C. Improved speech clarity. D. Difficulty walking and maintaining balance. Answer: D. Difficulty walking and maintaining balance. Rationale: as ALS progresses, patients often experience difficulty walking and maintaining balance due to muscle weakness and coordination problems. Increased reflexes, improved hand strength, and improved speech are not typically signs of progression in ALS. 37. Which of the following symptoms would be most concerning for a nurse caring for a patient with ALS? A. Difficulty chewing and swallowing. B. Minor muscle spasms. C. Slight changes in voice tone. D. Mild fatigue after physical exertion. Answer: A. Difficulty chewing and swallowing. Rationale: difficulty chewing and swallowing, dysphagia, can lead to aspiration, malnutrition, and dehydration, making it a more concerning symptom in ALS. Muscle spasms, voice changes, and mild fatigue are common but less urgent. 38. What is the most likely cause of death in patients with ALS? A. Cardiovascular disease. B. Respiratory failure. C. Renal failure. D. Infection. Answer: B. Respiratory failure. Rationale: respiratory failure is the most common cause of death in ALS due to the weakening of the respiratory muscles. Cardiovascular disease, renal failure, and infections may occur but are not the leading causes of death in ALS patients. 39. A patient with ALS is having difficulty speaking. What intervention would most likely help this patient? A. Medication to improve muscle strength. B. Use of a speech-generating device. C. Referral for physical therapy. D. Increased caloric intake. Answer: B. Use of a speech-generating device. Rationale: a speech-generating device can assist patients with ALS in maintaining communication as their speech abilities decline. Medication, physical therapy, and increased caloric intake would address other aspects, but not specifically assist with speech difficulties. 40. Which of the following is the main treatment goal for patients with ALS? A. Cure the disease. B. Prevent the progression of symptoms. C. Provide supportive care and symptom management. D. Increase life expectancy by 10 years. Answer: C. Provide supportive care and symptom management. Rationale: the main goal in ALS care is to provide supportive care and manage symptoms. There is no cure, and while some treatments may slow progression, the focus is on symptom relief and improving quality of life. 41. What is the primary nursing intervention for managing spasticity in ALS patients? A. Administering anticholinergic medications. B. Encouraging active stretching exercises. C. Administering muscle relaxants such as baclofen. D. Providing cognitive therapy. Answer: C. Administering muscle relaxants such as baclofen. Rationale: baclofen is a muscle relaxant commonly used to treat spasticity in ALS patients. Anticholinergics, stretching, and cognitive therapy are not appropriate for managing spasticity in ALS. 42. Which of the following is an essential consideration when educating a patient with ALS about nutrition? A. High-fat, low-carbohydrate diet. B. Adequate caloric intake to compensate for muscle wasting. C. Restricting protein to prevent kidney damage. D. Encouraging a high-fiber, low-protein diet. Answer: B. Adequate caloric intake to compensate for muscle wasting. Rationale: patients with ALS experience muscle wasting, so adequate caloric intake is essential to prevent malnutrition. A high-fat, low-carbohydrate diet and restricting protein are not appropriate for ALS patients, and high fiber is less relevant than caloric intake. 43. What is the role of riluzole in the treatment of ALS? A. It cures the disease. B. It helps manage muscle spasticity. C. It slows disease progression and extends survival. D. It improves cognitive function. Answer: C. It slows disease progression and extends survival. Rationale: riluzole is the only FDA-approved drug that has been shown to slow disease progression and extend survival in ALS. It does not cure ALS, manage spasticity, or improve cognitive function. 44. What is the primary concern when a patient with ALS experiences difficulty swallowing? A. Risk for malnutrition and dehydration. B. Risk for constipation. C. Risk for aspiration and choking. D. Risk for infection. Answer: C. Risk for aspiration and choking. Rationale: difficulty swallowing, dysphagia, increases the risk of aspiration and choking, which can lead to respiratory infections and other complications. While malnutrition and dehydration are also concerns, aspiration is the most immediate risk. 45. What is one of the first signs of respiratory involvement in ALS? A. Coughing. B. Shortness of breath during exertion. C. Cyanosis. D. Wheezing. Answer: B. Shortness of breath during exertion. Rationale: shortness of breath, particularly during exertion, is one of the early signs of respiratory involvement in ALS due to respiratory muscle weakness. Coughing, cyanosis, and wheezing can occur later, but are not typically the first signs. 46. What is the purpose of a percutaneous endoscopic gastrostomy (PEG) tube in ALS patients? A. To assist with speech. B. To provide respiratory support. C. To provide nutrition and prevent aspiration. D. To help with muscle strength. Answer: C. To provide nutrition and prevent aspiration. Rationale: a PEG tube is used to provide nutrition and prevent aspiration in ALS patients who have difficulty swallowing. It is not used for speech, respiratory support, or muscle strength. 47. A patient with ALS is having difficulty moving their limbs. Which of the following interventions would be most beneficial? A. Encourage the patient to rest frequently. B. Implement passive range of motion exercises. C. Recommend increased physical activity. D. Limit the use of assistive devices. Answer: B. Implement passive range of motion exercises. Rationale: passive range of motion exercises can help prevent joint contractures and improve mobility in ALS patients who have difficulty moving their limbs. Resting, increasing physical activity, and limiting assistive devices are not optimal interventions. 48. Which of the following is a key consideration when planning care for a patient with ALS who has respiratory failure? A. Providing a high-protein diet. B. Encouraging frequent ambulation. C. Considering mechanical ventilation for respiratory support. D. Discontinuing all medications. Answer: C. Considering mechanical ventilation for respiratory support. Rationale: mechanical ventilation may be necessary for respiratory support in ALS patients with respiratory failure. A high-protein diet, frequent ambulation, and discontinuing medications are not appropriate interventions for respiratory failure. 49. Which of the following statements is true regarding ALS and cognitive changes? A. Cognitive changes are not common in ALS. B. Most ALS patients experience significant memory loss. C. ALS is primarily a motor neuron disease without cognitive involvement. D. Cognitive changes occur only in late-stage ALS. Answer: C. ALS is primarily a motor neuron disease without cognitive involvement. Rationale: ALS primarily affects motor neurons and does not typically cause significant cognitive changes. While some patients may experience mild cognitive changes, memory loss and significant cognitive decline are not typical features of ALS. 50. Which of the following interventions would be most appropriate for a patient with ALS and progressive muscle weakness? A. Encourage weightlifting and resistance training. B. Administer anticholinergic medications. C. Provide a wheelchair and other assistive devices. D. Restrict caloric intake to prevent weight gain. Answer: C. Provide a wheelchair and other assistive devices. Rationale: as muscle weakness progresses in ALS, the use of a wheelchair and other assistive devices is necessary to maintain mobility and independence. Weightlifting, anticholinergic medications, and restricting caloric intake are not appropriate interventions for ALS patients.